Could the recent measles outbreak in Monongalia region be the wake-up call we need about the importance of immunization? With the first positive case of measles in the state in 15 years, it's a question worth pondering. State Division of Health recently finished contact tracing related to this case. The findings: 152 individuals potentially exposed to the confirmed case from Monongalia district. Of them, 128 are West Virginia residents from 30 counties, and 24 are out-of-state contacts from 4 neighboring states. Enter Dr. Matthew Christensen, State Health Authority. Dr. Christensen and his team have been tirelessly working with the Monongalia County Health Department. Their mission? To ensure adequate supplies for testing measles and for the availability of the measles, mumps, and rubella, or MMR vaccination in the region. Dr. Christensen shares, "We are ensuring they have the necessary resources, support, and expertise to carry out contact tracing for this one measles case. This is the first measles case we've had in a very long time." Measles is a highly contagious disease spread through the air by coughing or sneezing. Its symptoms include a high fever, watery eyes, a sore throat, and a blotchy red skin rash. These symptoms don't appear until 10 to 14 days after exposure. As Dr. Christensen points out, we are monitoring the situation closely and making sure we can isolate this case and keep other vulnerable individuals from getting sick. 62 of those potentially exposed don't have documentation of adequate immunity against the measles and are considered high risk. They are being asked to quarantine until May 9th or 10th, depending on their last date of exposure. For those without adequate documentation, Dr. Christensen advises, we recommend they see their healthcare provider to get what are called titer tests to check antibody levels to see whether they're immune or to quarantine. The measles vaccine is typically administered in 2 doses. The first dose is recommended between 12 and 15 months of age, with the second dose between 4 and 6 years of age. Those without proof of immunity, adults born after 1957, should receive at least 1 dose of the MMR vaccine. 2 appropriately spaced doses of the MMR vaccine are recommended for healthcare workers, students, and international travelers. Dr. Christensen adds, if they're born before 1957, we recommend they get another dose of MMR if they don't have other proof of immunity through titer or another measure. We urge people to get in touch with their healthcare provider. In summary, the recent measles outbreak in the Monongalia region is a stark reminder of the importance of vaccination and the role we all play in community health. As efforts to contain the outbreak continue, let this be a reminder to us all to stay vigilant, get vaccinated, and help protect our communities. Stay safe, everyone.